Today I want to ask you to think about someone you've probably never met. His name is Charlie Santana. Charlie is a New York City Public Service retiree, and right now he's fighting lymphoma at Memorial Sloan Kettering Cancer Center. Think about what that means. Every day is about surviving. Every day is treatment. Every day is about hope. The last thing someone like Charlie should have to worry about is whether his insurance company, like Aetna Medicare Advantage, will let him have the rehabilitation care that his doctors are recommending. But that's exactly what's happening today. Charlie was ready to leave the hospital for rehabilitation, and according to Charlie, the Aetna Medicare Advantage plan denied his rehabilitation facilities and instead approved one that was unacceptable to him. And when he refused to stay there, he was sent right back to the hospital. No one battling cancer should have to fight for an insurance company for their health care or for their life. No one. And Charlie isn't alone. His story is one of thousands. For years, the conversation about retiree healthcare has been reduced to budgets and savings and politics. We've heard about costs, we've heard about efficiencies, we've heard about negotiations in back rooms, but we stopped talking about the people. The teacher who spent 30 years educating children, the firefighter who ran into burning buildings to save our lives, the police officers who kept our streets safe, sanitation workers who kept our city clean, the nurse who cared for us when we were sick, EMTs and paramedics who answered the call when our lives were on the line. And of course, retirees like Charlie from New York City Transit that moved us through New York and got us to work on time. These aren't numbers on a spreadsheet. They're men and women who built this city. They are the heroes. That's why today we're launching our next campaign, Heroes versus Power Brokers. This campaign isn't about political parties. It isn't about personalities. It's about a simple question. What happens when the people who dedicated their lives to serving New York City find themselves fighting the very institutions that promise to take care of them in retirement? Over the next several weeks, we're going to be introducing you to those heroes. You'll hear their stories. You'll meet the people behind the headlines, people living with cancer, 9/11 survivors and responders, widows, teachers, police officers, firefighters, all city workers, retirees whose lives have been changed by decisions made in a boardroom, in a back room, and a government office, often never even having considered the impact that those decisions would have on retirees. This campaign isn't about asking for sympathy. It's about demanding accountability. Healthcare isn't a gift. It isn't a charity. It was earned through decades of service. It was part of the promise made to every single public servant who devoted their career to New York City. Heroes deserve better than having to fight for healthcare that they already earned, and especially when they're fighting for their life. Heroes deserve dignity. Heroes deserve respect. And heroes deserve promises kept, not promises rewritten. I hope you'll follow this campaign and share these stories and help us remind New York that before there were budgets, before there were negotiations and backdoor deals, and before there were politics, there were people who showed up every single day to serve this city. And now it's our turn to show up for them. I hope you follow this campaign, and if you happen to have missed Charlie's story, please check the first comment, and I will make sure to enclose the link to Charlie's first video. Thank you.